Okay, it's now the afternoon because it's already 12 noon. Okay, so this is a very nice time for us because I came before the OP. So now, us pediatricians will now receive these babies. So I will discuss about the uh, prevention of mother-to-child transmission and discuss this through the program of the DOH. So the DOH already has several AOs or administrative orders regarding HIV. These are your testing services, and then you also have the treatment AO, and this one, the AO on prevention of mother-to-child transmission. Although we already have updated this, but the secretary hasn't signed it yet, and I have several issues or areas of concern to address with this. So I hope we can discuss this later. So again, PMTCT is a mother-to-child transmission of the HIV. So it's during pregnancy, labor, delivery, and breastfeeding. So it's also referred as your vertical transmission or your perinatal transmission. And most children, young children, are infected through MPCT. And the prevention is actually a common, or PMPCT is a common term for programs. So these are strategies and interventions that are designed to reduce the risk of your transmission. So it was already stated earlier that if without this strategy, the risk of transmission is actually 20 to 45%. And this is during most of them during breastfeeding, but depends on whether the mother uses other breastfeeding practices like avoiding mixed feeding and then the duration of breastfeeding. Because with breastfeeding up to 6 months, overall transmission rate is about 20 to 35%. But if you would extend the breastfeeding period to up to 24 months, the transmission rate will go as high as 30 to 45%. This is now the global coverage of your PMPCT services. And this is in 2016. So look at South Asia, where we are included. So it's a very low data, 37% or 38% and 27% for the coverage for the infants. Now, reducing your maternal to child transmission through these core interventions is a strategy that um, includes the use of ART therapy or the prophylaxis for infants, particularly if they are provided with other interventions, such as safer obstetric practices, infant feeding information, counseling, and then support. Now, in industrialized countries like the US or Europe, women infected with HIV would receive the long-term combination ARV therapy, and they do not breastfeed. And this is where, and then they also stated there that where elective cesarean sections are safe, feasible, and commonly performed, the rate has been reduced to less than 2%. But actually, at the present, number of countries have already reached the elimination threshold. So that means late na naman tayo because we are still in the prevention. Okay? Like, so they actually, the data is for HIV and syphilis. So like Thailand and Malaysia, they are already in the elimination of the transmission. Okay? And the other countries would include your Belarus, Cuba, hindi ko nga alam yung iba eh. Zanzibar, Buda. Okay? So these other islands or countries have already eliminated the transmission. Okay. Armenia has eliminated the vertical transmission but not the syphilis. The other way around, Moldova, Republic of Moldova, has eliminated the transmission of syphilis, but not really for the HIV. Let's look at Africa also. East and Southern Africa has achieved the largest decline anywhere in the world, from 18% to 2010 to 6% in 2015. And I hope that they are going down now. So let's go to our local data. You have seen earlier the other data uh, that are more um, on the other transmission, but the mother-to-child transmission still exists. And this may be underreported. Why? Because most of our cases, the cases that we see now are especially they're less than 10 years of age, are really from the mother-to-child transmission. A total of 161 children less than 10 years old. Eight of them we saw during their adolescent age, and one adult foreigner. It's a 22-year-old, but is reported to have been acquired through mother-child. So now I will talk about the administrative burden for the prevention of mother-to-child transmission of HIV.